Good day. Hello, everybody. I'm Dr. Chip Whitney with Revolutionary Health Services. And for those of you who have not been on our broadcast before, I'm a family physician in Bucks County and an emphasis on prevention of chronic disease. And as my patients and the listeners have known for a while, what I talk about is the prevention of chronic disease is lifestyles to reduce inflammation. And inflammation is the key to coronavirus. So if anybody wants to see any past discussions on inflammation, they can go to my website at rhslivewell.com. So the last couple of weeks, we're shifting gears a little bit from inflammation and health topics to talk about where are we with COVID-19. And last week, I spoke to Wendy Thomas, who is our PA state rep from our district, and we started talking about what's it going to look like when we open up the state as we begin to transition from our button down up to the new normal, and how are we going to do that. And this week, I'm very excited to have with me today is Dr. Larry Brilliant. Dr. Brilliant is a physician. He's a ER physician by trade. And now he's worked his way from ER physician to ER director at Doylestown, then St. Mary, chief of the medical staff, and now he is the president of St. Mary Medical Center. So thank you for joining me today, Dr. Brilliant, and how are you doing?
I'm doing well. Good morning. How are you?
Great. I'm doing great. Thank you. So first thing I want to comment is that when this whole COVID broke out, and St. Mary is my hospital where I'm on staff, and I knew that you were the president, I was like, what better person to have as the president of a hospital during COVID is an ER physician? Because I'm a family physician, but in my 7 years in the Air Force, a large percentage of my work was in our emergency rooms. And it's a different animal in the emergency room. And one of the important things for a hospital is to be able to connect with the first responders. People hear a lot about and appreciate the first responders, of which you are one, but unless you live that world, you really don't know what that world is like. And it's so nice to have you as our president to be able to be the head of the ship of this crisis that we've been going through. So that's terrific.
Thank you. Thank you.
So what we're going to talk about today is several things. What we want to do is to talk about what is the current status in the medical community, in particular St. Mary. And then what we're going to do is talk about what can we expect. So just like we talked last week, what can we expect in businesses and the economy and opening up the state? What can we expect for our medical care? So first thing I'd like to talk about is where are we now? So I described in the past that everybody hears about flattening the curve. There's actually three curves. There's the curve of new cases of coronavirus. There is the hospitalizations, and then there are the deaths. So there are actually three curves that kind of come not simultaneously. So could you please explain where are we in Bucks County as far as working through the curve?
So we have flattened the curve. If you look at the community response between the social isolation, the masking, the hand washing, and the awareness of the COVID-19, we have been able to flatten the curve. Initially, some large institutions came out with projections. Where would we be in the next month going forward with COVID, different levels of social distancing? And at levels of 10 to 25%, we also are devastating numbers that would very quickly overwhelm the entire healthcare system. And that was in the 10 to 25% range. We're estimating now that social distancing occurred between 65 and 70%, which has significantly lowered our numbers, both at the county level as well as the hospital level. So our numbers at the hospital were constant for a while, but have slowly started to decline. The county numbers are also staying stable. We're starting to get a slight uptick in the county numbers as we're testing more and more patients. A lot of the patients who are tested are asymptomatic. So that means they have no symptoms. So even if we test them and they're positive, they probably are not going to necessarily need healthcare services. They contribute to the numbers. So we have to really take, as we evaluate the data, look at that. But the good news is ICU, ventilated patients, the number of patients in the hospital have been decreasing slowly. So we have flattened the curve, and that is a testament to our community.
That's terrific. So, yeah, that's nice to see that. And that was the goal at the beginning of all this, is to flatten the curve, not to stay shut down forever, but to flatten the curve so that our hospital systems, our medical systems don't get overwhelmed.
Correct.
Because we always get challenged every year with influenza, and it's this seems to be as a ER doc from Doylestown says, their admissions are like a bad year of inflammation of influenza up there. So that's good. So. I do know that the big problem we have right now, really everywhere, is the nursing home population, the vulnerable. And what we need to do moving forward is to protect the vulnerable, because it seems like the young folks don't get really bad cases. The middle-aged folks like myself, who you and everybody knows that I actually had COVID-19 myself, and it was not a pleasant experience, but you know what? I felt sick for a few days, got better, and now I'm feeling great. But we need to protect the vulnerable. And a big problem we've got is the nursing homes and the response of the nursing homes, and what are we going to do with a hospitalized patient when they don't need to be in the hospital anymore, but they still are potentially contagious. And because of the way things have happened, it's COVID-19 has gone rampant through nursing homes. What are you able to do when a person is ready to go home, but they might be contagious, when they're ready to go back to a nursing home, but they still might be contagious?
Yeah, so we watched what happened in Seattle. We watched what happened in New York. And as you mentioned, that vulnerable population we were very concerned about. And if there were outbreaks in multiple outpatient facilities, how would we handle that? Because that would very quickly overwhelm our system. Because as you mentioned, these are elderly, a little more of the vulnerable population. So we quickly partnered with all of our local skilled nursing facilities, nursing homes, personal care facilities. We have a consortium that met once a month. We increased the frequency of those meetings, and we had conversations with administrators, our staff, the medical directors of all these facilities, to quickly come up with a plan. We went into the facilities and helped them with PPE, education. That was the biggest part of this. They developed isolation wings within their individual institutions that were able to cohort those patients who were positive. Remember, even in that population, many are still asymptomatic or have very minor symptoms. And they were able to take those patients and put them in certain wings of their facilities to keep them safe. Here, we were able to test. So we know many of the patients who did have positive tests. But when they were sent back, they were able to be placed into isolation as we move forward. We're also able to walk through medical care with our medical specialists here in conjunction with these medical directors to keep the patients safe in these extended care facilities. So it was a consortium. It was amazing. The number of patients that we kept out of this hospital was tremendous while keeping them safe in their environment.
That's great. That's the key. That's the key here. We got to protect the vulnerable, and it's wonderful to hear a plan for that. So now that we're going to, seems to be either on the flat part or the back end of the curve, we can start to think about what's it going to look like to get back into normal. When can we get into doing when can I have my mammogram again, my colonoscopy? When can I get these things done? So, but in order to do that, we need to do it safely. We can't go from lockdown to old world right away. We've got to kind of transition it. What is the plan for St. Mary to allow it to be safe when people start coming back into the facility?
So I want to answer that, but before I forget, I also want to talk about ER utilization as
Yeah.
part of this also. I think it's just so important. We've seen national numbers that have reported between a 40 and 60% decrease in heart attacks coming to hospitals. We know we have not cured heart attacks. They're still occurring. We're seeing not a lot, but cases of patients that have waited too long. Coming in with ruptured of appendixes where it could have been taken care of earlier. When you have a stroke, there's medicines we can give, but there's a really distinct time frame to administer the medicine. So we're seeing patients coming in later in their course where they could have been treated a lot easier earlier in their course. So our ERs are open, our ERs are ready to treat people and want to treat people. At St. Mary, we have cohorted a whole unit for COVID. So if you're coming in with symptoms that are suggestive of COVID, placed in that unit. If you do not have that, you'll be placed in another unit. We're using full PPE. We're masking you and we're masking our staff. I just think it's so important. And one of the quotes that we've been using is the risk of not coming is greater than the risk of coming, because we are a clean environment and we really need to get that public service message out there.
I agree, because I myself have had to talk a handful of people into going to the emergency room, and they were afraid. They said, I don't want to go there. I don't want to get COVID. It's exactly the same discussion. Your risk of not going is going to be higher than your risk of going because of what might be going on. So
That's
I
correct.
encourage people to, most of we primary care doctors now are available by phone, telemedicine or phone call. And I encourage people, if you're not sure if you should go or not, sometimes if you've got pain that might be your appendix, you got to get there. But talk to us. We can help guide you when you should go. But I will, and to your point, I'm going to say that the local hospitals have been extremely effective at protecting people who come to the hospitals. Two stories I've got is that I do a little bit of the COVID-19 blood antibody testing that has some pretty good, specifically if you're positive for antibodies, you know you've probably had it. So I tested an ER physician, and because she figured she'd been probably going to be antibody positive. Well, she was a little disappointed when she was antibody negative, but so despite living in the pool of the ER for weeks, she had been protecting herself well enough to do that. And another patient was admitted to the hospital for a week for a non-COVID illness, and because of the protection that she had, she came out a week, and we did antibody testing on her also. And she also was antibody negative. So the infection control was very impressive. So yeah, please everybody, if you need to go to the emergency room, they're available. And if you're worried about a long wait in the ER, that's what a lot of our folks are worried about, sitting in the waiting room for hours like they've experienced in the past. That's not going to happen right now. And if you need to get there, get there.
Yeah, the other thing we're hearing is we don't want to overwhelm the ER. You're taking care of so many of the COVID patients, and your health comes first. That's the volume is our problem. We'll take care of it. We'll see you as necessary.
Perfect. So getting back to safety. So what is your plan to keep everybody safe when they start coming in for their mammograms and other things?
Sure. Very methodical and structured approach. Last thing I want to do today is say, let's open everything. We are good for business. So we're taking a lot of factors into account, and we're monitoring all these factors on a regular basis. Do we have enough protective equipment for our staff? Do we have enough masks for the patients? Are we testing the appropriate patient? So you spoke a little bit about the antibody test. We're talking about a test that says currently, yes or no, you have it. So we're going to be testing patients who meet certain criteria before their procedures. There's going to be no waiting room. The waiting rooms are going to be virtual. We'll call you from your car. You're ready for your test. Come on in. You can come back out. If there is a waiting room that's necessary, the seats are all separated now. We're using special cleaning techniques to make sure that the area is safe. We're creating different entrances and exits, COVID-free and non-COVID-free areas as you come into our institution, just like many businesses are looking at with the elevators to keep them clean and have social isolation. So we're really looking at it's a different world. And we're tying different phases of our recovery. And I'm not going to use the word reopening because we've been open. If you have appendicitis, if you need heart surgery, if you need any kind of acute procedure today, we are open in providing those services. So now we're expanding it. It's for those patients who before needed it, probably could put it off for a month, but now we're looking at 2 months, and I'm thinking cancer diagnosis isn't that kind of surgery. We need to start doing those. So we have a prioritization team that's looking at these cases. Be able to look at it and say to us, you're safe to go. We have the technology and the backup necessary. Let's do your case. And then we'll phase into more outpatient cases, then more outpatient elective cases. So like you're talking about, a routine colonoscopy might be more of a purely elective but necessary procedure, but someone who's having rectal bleeding would be more of an urgent type procedure that we'd be able to do a little earlier in the process. So we're working through that right now, but we need to assure first us and our staff that we're safe to proceed. We'll be doing some tabletop exercises this week to make sure we're not missing anything in the process. And then we're hopefully going to open up in the next couple of weeks.
Great. That's so important, because it's been very concerning. I know that the cancer treatments are being delayed, and that's not a good thing to be delaying as you get a cancer treatment. People are needing procedures for biopsies and things like that. And I mean, really, we've talked about the risk of going or not going when it comes to the ER is the same discussion for other medical issues too. I mean, we're at a point now where if we're on the back end of the curve, that if we don't start doing getting caught up on these really they call them non-essential medical procedures. Yeah, maybe plastic surgery isn't essential, but other things are very much essential. And I've never really understood why they were called non-essential, but it's going to be really important for people to do that. So folks, you can start contacting your doctor's offices if you know you've been needing something done. You heard it, to a week or two, the hospital is going to be reopening these things, and they're doing it in a really safe way. I heard the detailed version of what he just explained to you last week in our staff meeting, and they've really got a well thought through. They put a lot of time and effort in keeping you safe when you do go back into the hospital. And there's some things that are kind of open, more than just the ER and the, there's some things you're starting to begin to open up now, and over the course of time you're going to be opening up more. So yeah, so everybody, that's really going to be important to not let these things go. So so that actually kind of you touched on with the last topic I was talking about, the reopening of it. So is there anything else that you think that people would value in knowing as they're beginning? Because this has been a very uncertain time. Everybody's life has been disrupted, and uncertainty that we all have is stressful. Even if it's not bad things going on in us or our family, it's stressful. And what I found that my patients need the most, and that the most of my conversations have been giving them certainty of their situation. So is there any other thing you can think of that might give our listeners certainty in where we are right now with COVID-19?
Yeah, I think it's just so important that we continue our social isolation, listen to your government officials, listen to your healthcare officials, listen to your physicians who are there to give you guidance. Don't rush back into things. Still remember to wash your hands, wear your mask, and just follow as we move forward. I think that's a very big piece of this. We're dealing with our healthcare workers and the stress that they've been under, helping them with bedside support, other support services, having the conversations, because they're dealing with a level of sickness that they hadn't dealt with before. And we really need to remember the emotional portion of this also and offer support to everyone. Last comment with respect to support, this community has been awesome. The outpouring of donations, foods, cards, signs, is just a very emotional, and it's just so well received by the staff. Last Sunday and then again last evening, our local EMS, fire, and police did a drive-through parade to show their support, and we showed our support back to them. And there was probably over 100 vehicles that came through our campus, and we were out there cheering for them. They were cheering for us, and it was just very moving how we are all in this together.
It really was. Actually, I live up in Solbury, and then over the weekend I heard the fire engines going off, and I thought there was a fire in my neighborhood, and I realized what was happening. It was really exciting. And it's true. I mean, and I've been a physician for almost 30 years now, and this has been the most crazy time, including my 7 years in the Air Force, that I've experienced. But now what's happening is that the goodness in people really is coming out.
Yes.
I mean,
yes.
The crisis is going to bring out the worst in people, and it's going to bring out the best in people. So that you hear on the news where they sensationalize things, and it's true about the domestic abuse that's gone up and the crisis lines being called more. And it's true that people are, and so be on the lookout for everybody. But a lot of the folks is that they've got this time on their hands, and that the really the goodness in so many people have come out, and it's thrilling to hear. And everybody, you're terrific. I agree with him. I'm going to support everything he said about be safe. Opening up doesn't mean flipping a light switch on. It means that, we all have to wash hands more than we did before. We all have to be cognizant of not touching our face as much anymore. It's always been that way. And guess what? By doing so, you're not going to get the flu or other infectious diseases as much too. And quick comment on he commented a little bit about the differences between the antigen virus testing and the antibody immune testing. That if you want, that on my website, that was an interview that Wendy Thomas did with me, asking me about the different testings that are available. So if you want to learn more, go to rhslivewell.com, and you can see the 10-minute interview that we had talking about the different testings. And again, I'm going to wrap it up where I started, is that as we begin to go back to St. Mary, as we begin to go back to work, as we begin to see more people, as we begin to have, when we get into the yellow phase, and I just heard yesterday that Bucks County is rapidly moving to coming into the yellow phase of reopening, and we can gather with more people, and we're not on stay at home anymore, that boost your immune system. Boost your, the more fine-tuned you can have an immune system, and you can have an inflammation that's appropriate, that responds when it needs to, settles down when it needs to, that's how you're going to protect yourself. And if you do get exposed to COVID, you might never get it, or if you do, you'll just get sick for a few days like I did. So more information, and again, on my website, rhslivewell.com. I've got several articles talking about the inflammation, explaining in detail the concept of inflammation, why it's actually a good thing in the short term when you get exposed to something like COVID-19. So again, I want to thank everybody for joining us. Thank you, Dr. Brilliant, for being on with me today. I think this was hugely valuable. And again, I'm Dr. Chip Whitney. I want everybody to have a great day and stay safe out there.